Ilikuwa a very long journey, a very hard one. Maisha imekuwa ngumu kabisa.
I said, now, am I going to die without giving my people farewell?
I couldn't understand how we would move from a hospital where there is an oxygen supply, and then we move at home.
Throughout the COVID-19 pandemic, the need for oxygen has been evident. Most hospitals still struggle to access the vital commodity currently on high demand. And in the wake of the shortage, patients who require medical oxygen bear the brunt.
Niliposikia mpatikana corona, ilinistua sana because kwa akili yangu na kwa vile corona ilikuwa inaonyesha kwa TV venye inafanyika, inafanya watu, na kulingana na ugonjwa vile ilikuwa ni hatari, nilishtuka nikaona hapa tu ni Mungu ndiye amebakia. Huwezi taka mtu wako ende. Una kuwa na imani.
The pain and agony of losing a child is still fresh in Amina Juma's heart. Her son's dreams of becoming an engineer cut short by a disease that took advantage of an underlying medical condition that also robbed him of his childhood, as explained by the single parent who watched her son's health deteriorate with each single passing day.
Hati ilifura, ikakuwa breathing problem, yani haizi kupumua, haizi akalala straight chini, akilala anashindwa kubreathe. So ikakuwa lazima akuwe kwa oxygen. Bila oxygen haizi akabreathe. Unamkulisha hivi kitu kidogo saa ile napata chance, unampea 1 spoon, akieka tu chakula, oxygen anarudisha. Alikuwa hizi kabila oxygen. Kila mtu alikuwa anampenda.
Amina Juma, who is a resident of Nairobi's Majengo slum, says her son, who was diagnosed with diabetes at a tender age, was lucky to be on medical oxygen upon contracting COVID-19, but was not so lucky to survive the disease, making him among the over 3,000 patients who have so far lost the battle to the disease in the country.
Unaomba tu Mungu amponyeshe, amweke, at least kuwe na yeye. But ilikuwa sikuwa na hata nalala nikifikiria tu kuhusu ugonjwa corona. Sasa nilikuwa tu everyday, nilikuwa hata naogopa simu, nikiangalia simu hivi kileo nikiona imetoka hospitali naijibu tu, lakini haikuwa rahisi.
For those diagnosed with a severe form of COVID-19, oxygen can be the difference between life and death. Unlike Amina's family, 52-year-old Ruben Masharia's family tale is different. Masharia is from Nairobi's Komarok estate. He is a person living with diabetes and asthma. Masharia was admitted for 1 month at a hospital in Nairobi after being diagnosed with COVID-19. It is here that he experienced the true value of medical oxygen.
3 weeks before being hospitalized, I felt my body, unlike before, is not the normal attack which I normally have when I'm facing asthmatic attack. I felt there is something above. As we normally do, I just went to the chemist and I was prescribed some medicine, which I took for about a week. Then one Friday, as I was coming from Embo, I felt my body is somehow, muscles are like detaching from my bone. And I decided I'm going to pass through there is a clinic around. And as I was in that clinic, my wife informed me that she is also unwell. Tests were done on her, and she was told that she is positive. Then I started to suspect, even the way I'm feeling, I must also be positive. The oxygen in your body.
So true were his fears that he would later on be admitted in the same facility where his wife had been battling COVID-19. This was on the very day that he had gone to pick her after being discharged.
It was found that my oxygen level is very low, which was around 70. And the doctor asked me, "And you are not feeling anything?" Sure, I was not feeling anything, except that I was feeling a bit weak, but I was not in distress.
At this point, supplemental oxygen was key in managing Masharia's condition. He was still feeling strong. The doctors were confident that in no time he would be discharged.
I was waiting to be discharged because the guy we were admitted with on Tuesday, whom we boarded the same ambulance, passed on Wednesday. So I felt like this is not the place to stay.
But his excitement was short-lived. His condition worsened. He would stay in hospital longer, being assisted to breathe, gasping for air every so often.
The oxygen level are not going up because immediately I was put on the oxygen, they checked the level. The level was at 60. And then we waited, and the nurse told me, let us put it to the maximum, the supply to the maximum level, which they normally put it at 20 liters per minute. And we see whether it is going to improve. So I waited throughout the night. It was not improving.
Inside the COVID-19 treatment ward was like a battlefield, says Masharia. Just like the other patients, his was to fight to live.
I said, now, am I going to die without giving my people farewell? Then I decided I have to. As much I'm telling them I'm okay, this disease is taking one without saying goodbye. Then I decided I'm going to write farewell to my family members. Since I didn't have a notebook where I could write, so I just picked the serviettes. I picked about 20 papers, 20 pieces of serviettes. And then I started writing. This one was to my daughter, to my sons, since I have 4 sons. Then to individual, starting with the first one son, Ryan. Then the second one son, Ruel. Then Reese. Then Renzi. Then to my sisters, the biggest one, Nancy. The next one, Monica. I did that from midnight up to around 3 in the morning. Then I decided to sleep.
In Siaya County, Judith Akinyi Osoro, a mother of 2, is still overwhelmed by her loss. She knows too well how critical oxygen was to the survival of her husband, who unfortunately lost the battle to COVID-19.
Aliniambia kupumua ni ngumu, Kupumua ni ngumu, hata hiyo kitu akiwekewa aelewi kama ni vipi, anaona tu hawezi pumua. So ndio nilikuwa namwambia kama kupumua ni ngumu, sababu tuliongea naye kama mara mbili. Mara kwanza aliponiambia kupumua ni ngumu, hata nilikata simu sababu singeongea naye. Ya pili naye akasema anateseka, hawezi pata kupumua vizuri. Na hiyo hata ndio tuliongea naye last hivyo. Naona kungekuwa na oxygen, at least ingemsaidia. Tulikaa karibu 4 hours, hakuna oxygen. Na hata walipojaribu kuitisha oxygen kutoka huko sehemu zingine kulikuwa hakuna oxygen. Na hata Makadara pia hiyo wakati tukienda tukimpeleka usi Makadara pia bado tulikuwa hatuna oxygen kwa gari. Hizo nini zote hiyo mambo na oxygen, at least tungepata oxygen mapema, at least labda ingemuokoa.
Oxygen is an essential gas for any living organism. It's in the air we breathe and even the water we drink. However, for people diagnosed with respiratory diseases, medical oxygen is critical for their treatment. While there is concerted effort underway here in the country and further afield to make medical oxygen accessible, experts say there's need to address the current gap to facilitate urgent treatment to COVID-19 patients.
Once COVID as a virus has compromised your lung capacity to breathe and of course to exchange oxygen, you end up desaturating. And so for such patients, we'll want to give them oxygen as we give them medication. So as they heal, we also provide oxygen, because without that oxygen, then they will not be able to survive.
Before COVID-19 hit home, creating a huge demand for oxygen, only a few facilities had oxygen manufacturing plants, with majority depending on the British Oxygen Company for cylinders used to supply the facilities with a crucial gas. However, the number has since grown and counties are rushing to construct oxygen manufacturing plants to cater for their oxygen demands.
About 15% of cases of patients who get COVID will end up being hospitalized, and about 5% will end up becoming critical. And again, out of these critical cases, we'll end up losing about 50%. So that's the epidemiological data we have, which is consistent to the cases that we are actually managing at our facility.
Kisumu County is one such county that is set to unveil an oxygen generation plant at the Jaramogi Oginga Odinga Referral Hospital that has been handling a huge number of COVID-19 patients from the region.
We have an oxygen tank, all right? It is liquid oxygen tank. It can run comfortably for about a week to 10 days. There's during low demand and during high demand. Right now there is high demand. In support for this, we are also building an oxygen manufacturing plant which is capable of producing 500 liters per minute. And the hospital at the moment may require only 300 liters. So the extra 200 liters will be making available to peripheral hospitals to be able to manage cases of COVID. So the plants for manufacturing oxygen will be ready in June for operation.
The facility's oxygen consumption has been on the rise due to the number of severely ill COVID-19 patients who require oxygen therapy. Dr. Rai says the hospital's biggest challenge is replenishing the huge consumption and acquiring the necessary amount, making maintenance of oxygen cylinders an expensive and unreliable affair in the wake of this pandemic.
We do like 6,000 liters per week, and it's pretty expensive. To fill up the tank, you spend approximately 1,800 shillings, 1.8 million shillings. So you can see the expense and complexity of looking after COVID-19 patients.
Kisumu County, just like the counties of Homa Bay, Bungoma and Kakamega, depend on Siaya County for their oxygen supply. This facility at the Siaya County Referral Hospital has been producing oxygen that is used at the facility, with the surplus being sold to other facilities. With the onset of COVID-19 and subsequent waves of the disease, the plant's manager says the demand has been going up.
Before COVID, we were producing between 30 to 40 cylinders per day because demand for oxygen was not that high. We didn't have isolation centers, we didn't have COVID. Majorly, we used to distribute in hospitals that have ICUs. Those are the highest consumers. But currently, now that we have COVID, it's majorly going to COVID centers.
Whereas it will be noble to have a sufficient supply of oxygen in all the 47 counties, experts warn that constructing oxygen generating plants and cylinder filling systems in all the 47 counties would not be feasible, as counties might struggle to utilize the installed production capacity to take full advantage of their capital investment unless they can distribute cylinders to the surrounding counties. The advice on the need for counties to work together to ensure the right size oxygen delivery solutions as setting up an oxygen plant is not a cheap affair. According to an estimation by Hewatele, one would require around 50 million shillings for the plant machinery, another 10 million for construction of the plant house, and a further 5 million shillings for a standby generator in the event of a power outage. With the plant set up, one would also require cylinders to facilitate distribution of the gas, and you would part with not less than 27,000 shillings for a single cylinder, not forgetting the cost of logistics. Oxygen access has been a long neglected element of healthcare systems planning, despite being an essential treatment for a range of diseases. In April this year, Kenya's biggest referral facility, Kenyatta National Hospital, announced the scaling down of surgical procedures as an oxygen shortage hit the facility. The facility said its oxygen consumption had gone up from 4,000 liters per day to 8,000 due to an increase in the number of patients who require ventilatory and critical care support. Lack of maintenance of oxygen plants in government facilities has also been cited as one of the systemic failures, leaving the country gasping for the natural resource that has turned rare and expensive. Despite maintaining preventive protocols, some people like Ruben Masharia may still contract the virus and have to fight for survival, even when the situation seems bleak.
I looked back at her and I told her, Daktari, siendi. And then I went back to my position. And then within myself, I just said, she must have thought I'm saying I won't go to HDU. So to make it clear, I told her again, Daktari, yani namaanisha sikufi. And she was very happy.
It is this zeal and determination to live that would later on see Ruben discharged from the hospital. However, his oxygen therapy was to continue at home, a decision that came as a shock to his wife, Jane Waithera.
It was very clear from the doctor that he wouldn't have released him until I tell him that we've gotten a cylinder. So then that was a task for me to start looking, so where am I getting cylinders? You know, everything that CS keeps talking about was actually being replayed, you know, in my life. You know, he talked about the issue of no beds. I experienced that. Now he's talking about maybe people using at home. Now this is people using oxygen at home. It is now happening to me.
Jane says that on top of her husband's medical bill that was over 2 million shillings and is still pending, the family had to part with another 50,000 shillings for the oxygen accessories. Ruben has to constantly monitor his oxygen saturations using a pulse oximeter, a device doctors say is important for any patient recovering from severe COVID-19. He also has to do spirometry exercises in order to help improve his lung capacity. More than ever, timely and robust planning for reliable oxygen delivery is needed to protect lives. Experts say the need for oxygen goes beyond the current pandemic. Hence, the need for governments to invest in accessibility and steady supply of the crucial commodity in a bid to save lives. Gloria, Milimu, KTN News.